take off the dust cap, give it a shake, put it into the spacer, and this provides a space and time for your child or baby to breathe in the medication without any eye-hand coordination. So before your child can actually inhale this, it must be shaken. So you can tip, shake, tip, shake, tip, shake, or do a vigorous shake. The key thing is shaking up the medication with the spray so that you don't give all spray and no medication. Squirt one dose only at a time, no more, just one. Then put the nose piece of the mask over the nose of your child or baby, and the rest of it goes over the mouth. There should be a nice tight seal over the nose, over the mouth. It's a bit easier to show you with an adult size one. Nice tight connection. And then your child allowed to breathe in and out 10 breaths to absorb the medication, breathe it in and empty this chamber. Any less, you're not certain that they're going to get the whole amount that they should be getting. Now, when your child has been to the emergency room, they may well have advised to give a reducing dose regime of the Ventolin, salbutamol, Salamol or albuterol. Could be called any of those names. This is what we call a reliever, so it relieves wheezing, relieves asthma symptoms.
Here is an example of one of the reducing dose regimes, but do follow the advice given to you by your practitioner.
So the correct way to use one of these on a reducing dose is exactly the same as if you were just going to give 2 puffs now and then. Shake, squirt one dose only, remember, into the chamber, and then breathe in and out 10 times. Obviously, this is designed for a baby, not for me. Okay, so that's the correct way to use it. If you've been prescribed one of these, this is called a volumatic. It is a large volume spacer. There's no preference between one or the other. You still have the same technique, and it's got a valve that you can hear that's in the mouthpiece. This, with a mask on the end, can be quite preferable for much younger babies, say under a year, because when the inhaler is in the end, I'll use the pretend one again, put that in the end, shake, or tip, shake, tip, shake, tip, shake, squirt one dose in. If it's a newborn baby, tip this large volume spacer at a 45-degree angle, and that opens this valve and allows the baby to breathe in and out, in and out. Okay, so 45-degree angle for a baby with a mask on, or older children can do it just like this in the mouth. Again 10 times, and you can hear the valve moving.